Welcome, my name is Barbara, RN, and today we're going to discuss how to function as a part of a healthcare team.
My name is Dr. David Goldstein Steinmetz, and I'm the Director of Clinical Education here at Northern Midwest University, University College School of Medical Sciences. One of the most difficult parts about being a health sciences student is moving from the books to the clinical environment. We hope with this video series that we can give you skills and tips that will prepare you for that first clinical encounter. And this is our medical student. Could you introduce yourself?
Billy.
What's your last name, son?
Ruben. Billy Ruben, sir.
There you have it.
We're excited to have you on this journey with us.
Oh, wait, I parked in a meter. Shoot.
Nursing is arguably the most important aspect of healthcare. I mean, they go to school more than basically anyone else that's in the healthcare system, so obviously it's the most important. Come with me, I'll show you how it's done. I gotta go, I have a patient here. Alright, okay, bye. Alright, sorry about that. So you're here for a checkup, I hear?
Yeah.
Okay. Alright, well, I'm just gonna go ahead and get started with some vitals. It is a little known fact that when listening, you really only need to listen to one part of the body. You can hear all the noises from there. So I'm just gonna take a listen here at your elbow. Sounds a little congested in there, but you know, I'll let the doctor know about that. There must be congestion somewhere in your body because I can really hear it in your elbow there. All right. So after you take a listen to their body, check the vitals. It's best to have a pre-inflated cuff. And fun fact, the hand is the best place to actually check the blood pressure, and you don't need a stethoscope for this. It's mostly just an accessory to look pretty around your neck, like a necklace, you know? So you just kind of feel it, give it a few more puffs, look at the numbers. 120/80, you know, that's the ideal one. And most people her age are right about there, so we'll go with it. The patient has become a little bit more comfortable with you. You ask a few questions. They're more screening-based questions. And it's also best for you to keep your back towards the patient so they feel comfortable and not judged when responding. For example, have you ever done cocaine?
No.
This includes the assessment portion of nursing. So you ensure that your patient is feeling comfortable and heard, but also not judged. So at this point of the physical, it is time for me to pass my torch on to the doctor and his team to continue on with the assessment. So nice to meet you, girl. See ya.
I need a doctor, call me.
Rounding on patients is a sacred tradition of medicine. The whole team, including the attendings, the residents, the fellows, and the medical students, see patients together. Come with me to the clinic, and we'll see what we got. First, when entering a patient's room, you want to introduce yourself. Hi, my name is Dr. Goldstein Steinmetz, and I'm the attending physician here on medicine.
I'm Dr. Future Billy Ruben. I'm going to orthopedic surgery.
Mother of God. Now, the best way to teach students, and something that every student should be ready for when they're on the wards, is rapid bursts of questions, like an ambush. What's the gold standard for diagnosing pneumonia?
Chest x-ray.
That is wrong. The right answer is a stool antigen assay. Let me explain. The lungs clean the air. Now the body is 70% air. Therefore, residual air enters the GI tract, and pathogens, such as viruses and fungi, all sorts of pathogens, can enter the GI tract and be detected by the laboratory. Ah, the patient. Now the nurses told me that they heard some congestion in your elbow. Ward's tip. always double check nursing findings, as they are usually wrong. Would you like to listen to her elbow?
Sure.
It's important for physicians to teach students, in addition to hammering them with questions. Would you like to test this patient's reflexes?
Yeah.
Well, let's first start out with a proper position, okay? You want to straddle the patient to assert your dominance, okay?
Okay.
Now, the object of testing reflexes is to strike the patient's bone with so much force that the brain has no choice but to kick the leg, okay? Let's give it a try. Oh, you hate to see that, especially on the first day. Oh, God.
Everything is awesome. Everything is cool when you're part of a team.
Hey, Doc, I think we did a good job with this patient. Good teamwork.
Yeah, when health professionals work together, we can always get to the root of the problem.
Yeah, like, did you hear the congestion in the elbow?
Yes, I did. Yeah.
Yeah, what ended up being the diagnosis for this patient?
Neural viscous fascial degeneration.
It's a muscular thing, right?
It's a whole lot of things.
Well, I'm glad we figured it out.
Me too.
Do you smell that?
Oh God, I think I just shit my pants.
Welcome. My name is Barbara.
Introduce yourself. This is our medical student.
Billy Rubin, sir.
Can you introduce yourself?
Dr. Rubin, sir. No!
It hurts me.
Oh, okay. No, you know I have those. I have to rub it.
As a nurse,
Rub it out.
a lot of times you get the
Oh,
disgusting
left.
jobs that
Medial.
no one wants to
More
do.
medial. Oh, yep.
Especially for these doctors.
Oh my God. Yep. Ooh.
Lots of favors for the doctors.
Problem. Which in this case.
Oh, come on, Danny. I was going to be like
Oh.
checking the elbow and stuff, remember?
Wait, what?
Let me say.